Okay, good morning, everybody. Welcome to our webinar. We're going to be introducing this new member benefit. Let me first introduce you to Tracy. Tracy Ford has over 10 years of experience in employee benefits and is a licensed financial advisor. She's the founder of Elite Supplemental Benefits and works with employers to identify coverage gaps and implement compliant addictive benefit, additive benefit strategies. I can't see. Her focus on supplemental coverage became personal after a close family member went through cancer treatment and faced significant out-of-pocket costs despite having medical insurance. In 2021, Tracy became a financial advisor to help clients protect both their health and their assets. And now I'll turn it over to Tracy to introduce Brad.
Hello, good morning, everybody. Thank you for taking the time to join. I have Brad Smith on here as well. He is a tax strategist with Empower Financial, and I didn't have the whole intro, Brad. So if you want to say anything else about yourself, I apologize, but he is here to go over and take a deeper dive into the benefits. So we work with employers any size from 3 employees all the way up to 10,000. So as Margie mentioned, this is a chamber member benefit, and we're going to go over it today. And what it does is it helps your employees while also increasing the company's bottom line. So the Greater Rockville Chamber added this, so it's not just a networking. Now we're going to really affect the company's bottom line. So what it is, we're going to go over that today, and I'm going to let Brad dive deep into that. But we are going to show you how to implement a preventative care management program that will improve your employees' health, which will help with retention, add additional benefits at no cost to your employees or to you as a company. It's also going to help reduce strain on your major medical and, as a byproduct, increase the bottom line. So, Brad is going to walk through the details and the compliance of how it all works. And then it'll come back to me and I will answer any, or we'll open it up for questions at that time and go through the next steps in the process. So, Brad, at this time, I'll turn it over to you and you can go into the details, deep dive of how it works.
All right. Well, thank you all for having me on this morning. Again, Brad Smith. We work with, so I'm the owner of Empower Financial Group. I work with a partner with Tracy and chambers all across America. So it's exciting to have this new partnership with Rockville Chamber of Commerce. What I want to do is share with you the significant impact that you can have. You know, a lot of times when you're employers and members of a chamber, a lot of people join chambers for value, right? They go there to get something out of it, to be able, and being part of a chamber is being part of a community, creating synergy. Um, Really, when you look at in any industry that you're in the United States, if you go to a conference or you go to a chamber events today, I'll actually be speaking at the Missouri Healthcare Association in Jefferson City, Missouri. But when you go to these conferences, there's three main issues that all employers are facing every day. One of those is how to get more employees, so recruiting. You know, everybody's got a now hiring sign outside, right? How to retain your current employees, so retention. And then the other big R that I like to call it is revenue, so money, right? Um, too much money, there's no such thing. There's no country song about that, I think. So recruiting, retention, and revenue. That's on every agenda in America, no matter what conference, what business entity you go to. So what we want to do is today is show you how being part of the Rockville Chamber of Commerce, if you're in an employment situation as an employer, what we do is we help employers all across America get additional benefits funded for their employees without their take-home pay going down. In fact, their take-home pay goes up a little bit, so getting a pay raise, all while the employer, being the business, is putting money back to their bottom line. There's where the revenue comes in. It's just through lowering taxable wage, which gives a 941 tax savings. If anybody's on here as an employer, you know that all employers in America pay 7.65% of taxable wage. There's usually when when an employer is looking to lower their budget or figure out how to cut cost, you're usually trying to cut the fat, right? Because fixed expenses just exist. There's very few fixed expenses that you can actually cut without cutting labor costs, without hiring people at a lower rate. But that's just not what happens in America. With inflation, things continuously rise. So we're one of the very few resources that employers in America have to lower that taxable wage by $14,076. But you're probably wondering, how does that work? Because the first thing that comes to your mind when you hear employers can get their employees additional benefits without the employer paying and without the employees' paychecks going down, you immediately think, well, that sounds too good to be true, right? That's the common. If I had $5 for every time I heard that, we wouldn't even have to be on this call. We'd have enough wealth to go around. So I want to share with you how that works. Okay.
Okay.
First and foremost, you got to understand the Section 125. Okay. Section 125 is known as a cafeteria plan. It's been around since 1979. So there's nothing new about lowering taxable wage. Okay. That was allowed back in the late 70s because not many people had health insurance in the late 70s. Our government, along with the lobbyists for the healthcare associations, the United States Health Board with Congress and the IRS, they said, hey, we're going to incentivize Americans to purchase health insurance by allowing employees to purchase health insurance and pre-tax deduct the premium for that out of their paycheck, which would lower taxable wage, therefore giving a tax savings. That was the incentivization. I bring that up because health insurance is key to this program, okay? In the early 80s, a Section 125 bled over to 401ks, 403bs, dental plans, qualified plans. You cannot pre-tax deduct your car insurance out of your paycheck, right? We wish we could, but we can't. Now let's fast forward to 2010 to 2013 time period. Something happened in America that forever changed America. 3 letters, ACA. We are all used to seeing that now. The idea behind the Affordable Care Act was to make health insurance and medical expenses more affordable. Did it really happen? No. Health insurance premiums have had a 362% increase since 2012. Okay. If you think about that, if you think about this increase and you think about the Affordable Care Act time period, before the Affordable Care Act, you never really heard of like telehealth or EAP programs. All of a sudden, after the Affordable Care Act, EAP become really, really popular and telehealth. Every carrier and every major broker in America was coming around to employees or employers saying, hey, if we can get enough of your employees to use our telehealth program that's associated with United Healthcare, the Blue Crosses of the world, the Signals of the world, all these big companies, they said, hey, if you can get enough of those to use that, we'll give you a discount on your health insurance premiums. Why would they do that? Because they realized and learned that if somebody would see a doctor virtually or a counselor virtually, it kept them from going up to the emergency room for things you should not go to the emergency room for, right? The average cost to go to the emergency room in America today is $11,300 just to walk through the door and show your health insurance card. Somebody's paying that. The employees usually not, but they're getting a stack of bills when they come home in a month of deductible that they got to pay. But the employers, that group plan is paying it, which causes premiums to keep on rising. Okay. Now, why would the government allow this thing, the substance of this call, come about that I'm going to talk about to happen? And it's called a SIMRP, Self-Insured Medical Reimbursement Plan, SIMRP. Got filed on page 33,161 of volume 78 of the U.S. Federal Registry as an amendment to section 105 in June of 2013. Okay, now later Tracy will be able to communicate with any employer to give them compliance documentation on that. But let's think about that Affordable Care Act time period and the tax world. We all know that every time our government passes something through the Senate or through Congress, that there's always a ton of tax code changes that follow, or new tax codes that get slid right on in the tax code. During that time period, there was 8,800 pages worth of new tax codes or amendments to tax codes that got filed during that time period. One of those was the amendment to Section 105 that I just mentioned. How does it relate to what I'm talking about right now? Well, what it was it was a way that our government was utilizing. They done the same thing that major medical carriers did. They said, we got to incentivize Americans to utilize preventative care management programs. And Tracy, that's where, if you can pull that one page up.
Absolutely.
They realized the same thing that the carriers did. They said, how do we get employees of qualifying companies to utilize preventative care management programs? So as an employer that qualifies for this program, how do employers qualify? You got to offer health insurance to your employees. That does not mean they have to be on your health insurance plan. They can be on a spouse's plan, TRICARE, Medicare, minimum essential coverage. They got to be a W-2 employee, and they got to make at least $17,000 a year. So some of those things that I just mentioned debunk the fact that anything that I talk about today would be too good to be true, because there are thousands of employers in America with less than 50 employees that do not offer health insurance to their employees. They do not qualify for such a program. There's a lot of employers in America that pay the majority of their people on a 1099. So self-contracted individuals, they don't have payroll taxes, so they wouldn't qualify for this program. If it was too good to be true, everybody would be on it, right? But it's not. So as an employer, you qualify for the program, which is just check those three boxes. Your employees then would have 24/7, 365-day-a-year access to the things you see on the screen, our Attentive Preventative Care Management Program, where they all would get an app on their phone or their computer to utilize these services such as telehealth, diabetes, weight loss management, relationship counseling, family counseling, legal counseling, addiction recovery services, and Mayo Clinic advisors. And everybody knows who the Mayo Clinic is. Can you imagine if your employees had 24/7, 365-day-a-year access to all of those items with no copays, not just for the employee, but for their spouse and dependents as well that get to use that? What our government figured out is the more that people use this, the less it keeps them going to the emergency room. Let's use this example. On a Saturday afternoon, little Johnny gets a sniffling nose and a fever. What does most mamas do on a Saturday afternoon at 3 o'clock? They run him up to the emergency room. So some like to say the urgent care, but if you live in rural areas where I live, the 45 minutes away is the closest emergency room and the only thing open. So that's where you go and you show your health insurance card. Well, somebody's paying $11,300. That's not what you should go to the emergency room for. You should be able to get on here, see a doctor in about 10 minutes. They're going to call in an antibiotic and a steroid like they have for my own child before down at the local pharmacy. You go down there, pick it up, and it kept you from going to the emergency room. So our government needed to incentivize people to use these types of products. So that's when they made an amendment to Section 105 in June of 2013 called a SIMRP, SIMRP. And they said, hey, employers that qualify and are enrolled in this program, there would be some changes that would take place on the paycheck. So I want to show you a paycheck example, and I think it will make total sense for you all as an employer. Now, this is a monthly paycheck. We deal with over 500 school districts in America. Most of our schools are all monthly pay. So I'm going to show a monthly pay. Just know that a lot of you all may be on bi-weekly, maybe semi-monthly, maybe weekly. Just know that your numbers, transactional numbers on a paycheck would be less, okay? Let's say that Tracy works for Rockville Chamber, and on the left, before our program, before Attentive, she makes $3,288. That's her gross pay. Let's say she already had some pre-tax deductions. This shows major medical for $500, Don't get caught up in the word major medical. That could be 401k. Okay. I'm just illustrating that there's nothing new about a pre-tax deduction. They've been happening on a section 125 since 1979. Okay. But Tracy was a smart employee. She was already lowering her taxable wage to 2788. That's now what she pays taxes on, not 3288. Okay. Who else was benefiting whenever the employee like Tracy lowers her taxable wage? Rockville Chamber, the employer in this scenario. Okay. Because all employers in America match 7.65% of taxable wage, not of gross wage. Okay. So lowering box number one on your W-2 is a very smart thing to do as an American. That's your right. Her withholdings come out now. Her federal withholdings, Social Security, Medicare, and state withholdings all come out in the amount of 687, and that goes out in the Rockville Chambers EFTPS statements. They're monthly 941s, like any employer in America pays. And Tracy's take-home pay is 2101. Pretty simple paycheck. After the employer, in this case, like Rockville Chamber, says, hey, we like this program. We don't want our employees to be on it. We want the tax savings. Tracy's still making $3,288 now. We're on the right side of the paycheck. Nothing's changed on her wages. She still has whatever benefits she already had in place as a pre-tax deduction. I want to stop right there and say, we as a broker and financial advisors, when we come in, we're not trying to replace or change or disrupt anything that an employer already has going on. We tell employers every day, keep everything that you have. It's great. Keep it. We're just going to bring like a new Cadillac Escalade in and park right alongside the benefits that's already in place. Okay. So Tracy still has her $500 pre-tax deductions. Okay. All of a sudden, there's a new pre-tax deduction of $1,173. Don't let that alarm you. It's not lowering anybody's take-home pay. You all are smart and probably have already glanced at the bottom. If we were deducting 1173, her paycheck would be down. Her take-home pay would have decreased by 1173. But let's follow the chain. That 1173 is the premium or the actuarial value for that portal, that program that I showed you, that Tracy showed on the slide before this one. We take guidance from the Department of Health and Human Services. They value that portal, that attentive portal that your employees get access to on their phone at $14,076 a year. You take $14,076 and you divide that by 12, gives you $1,173. If you were to divide by 26 for biweekly pay, that would be $541.38 and so on. But in this scenario, it's $1,173 because it's monthly pay. Okay. We're allowed to pre-tax deduct that on a section 125 as a payment to a health service provider. That reduces Tracy's taxable wage from $27.88 to $16.15. Okay. I've never met a CPA, financial advisor, or tax attorney in America, and I have meetings with them every single week, okay, that has ever said that this is a bad thing. Whenever you lower taxable wage, that is one of the smartest things as an American you can do because that lowers box number one on your W-2, which is what you pay taxes on, okay? Tracy's withholdings now have decreased from left to right. You can see federal withholding has decreased down to 193. Social Security has decreased from 172 to 100. Medicare from 40 to 23, state from 1 to 39 to $80. By decreasing those withholdings, that does not mean that you owe taxes at the end of the year. It means you owe less taxes now because your taxable wage has been lowered by 125, okay, by section 125. So her withholdings go from 687 to 398. I want to back up for 1 second. Who else benefited whenever Tracy lowered her taxable wage from $27.88 to $1,615? The Rockville Chamber did because all employers match 7.65% of that number. So when an employee lowers that number, it also lowers the 941s for the employer as well. So Rockville Chamber in that scenario just netted $600 in savings $596 to be exact, back to their bottom line per employee per year. Okay. Now, if you get that back down, total taxes went from 687 to 398. Tracy now has this number doesn't show up on a real paycheck, but I want you to know where the money is that funds these additional benefits for Tracy. Okay. She now has $289 worth of gross tax savings. $89 does show up as an entry on a monthly paycheck. It comes out, it goes to attentive. Okay, we have 7 tax attorneys to pay, 2 ERISA attorneys, and about 50 compliance people. That's called overhead. And then all of those services on that slide before this one, the UCM dial cares, the Mayo clinics, the Freedom 365s, the Anura apps, they all got to get paid. That's where all that $89 is going. That leaves Tracy now with $200. That $200 is what we use. If you look down below in the red box, we use that to purchase additional benefits for the employee, such as critical illness, accident, life insurance. So in this example, and Tracy can get creative with the employers on that. We can do different things. But in this scenario, to follow along, we spent $198 of that $200 on additional benefits. If we stopped right there and ended payroll without talking about this other yellow line item, Tracy's paycheck would go down a whole lot. Okay. But this other yellow line item is what come about in 2013. SIMRP, acronym for Self-Insured Medical Reimbursement Plan. It falls under 1.105-11, Section K, Section 2 of the U.S. Federal Registry. And it's a separately written plan document that our ERISA attorneys have to draw up for every employer in America that's on this plan, that states in this scenario, Rockville Chamber qualifies for this plan. They're structured as a self-insured model only for this plan, not for health insurance, but just for that preventative care management program that I showed you before this. And it states that Tracy up there has contributed. She has participated in this plan. She's contributed $1173 to the plan, which is also the employer at this point. It's so that transaction goes as a credit to the employer's liabilities account. And then down below this bottom yellow line item, it's a non-taxable post-tax reimbursement. So it's reimbursed back to the employee. It's a non-taxable event. Therefore, Tracy's take-home pay has went up a couple dollars. She as an employee has additional benefits now for her and her family. She also has that preventative care management program to use, which should keep usage off the employer's health insurance plan if they use that more often. And Rockville Chamber has now saved $600 in 941 payroll taxes that they've kept instead of paying out like they currently are. So it's a win-win for everybody. So as an employer, let's say you're an employer with 100 employees and that you had 100 employees on a program just like this and their checks look like this, you would save $60,000. You'd really keep about $59,600 back to your bottom line every year. That's a given. We deal with, she put on there small companies up to 10,000. I actually have a group over on the East Coast over called Coons Auto Group. They have about 20,000 employees. They're on this program. They're one of our oldest clients, as a matter of fact. So that's the program. Employers save payroll taxes. All the employees, not just some of them now, are able to get a very rich package of benefits that they're not paying for. And the employer, you're not having to reach in your hip pocket and pay for. And you got a safer and healthier employee. Is there any questions on this flow, on this paycheck example and this flow before we move further? This is just a revenue strategy that I will say this and shows the paycheck only goes up a couple dollars. We usually leave it where the paychecks go up $15, $20 per pay period. And then the employee gets additional benefits. And in all examples, the employer is always putting $596 per employee per year back to your bottom line in 941 savings. So you see immediate impact on the very first payroll. You're not waiting for a check to come back from a government. Right now, if you're an employer, you are paying money out after every payroll, about 3 days after payroll in EFTPS statements to the government for your payroll taxes. You would see an immediate decrease in that with this program implemented.
Hey Brad, I got a question for you. So looking
Yes,
at the life insurance line item there, correct
yeah,
me if I'm wrong, but that could be a Mass Mutual or another quality company whole life insurance plan, which means the employee could actually have cash savings built up in their policy over time so that they have a future benefit supplement at retirement.
absolutely. Very, very good call. You can do that. Our schools, we have over 200 schools in Oklahoma. Those schools help their employees use that for 403Bs, which is an additional annuity, which builds additional retirement for the employees. So great example, Steve. In fact, in Oklahoma, we call it our 4R strategy: recruiting, retention, revenue, and retirement.
Yeah, I was also going to point out that the accident and critical illness policies make payments directly to the employee that in the era of health insurance today where the deductibles are just getting higher and higher and employees have out-of-pocket expenses, those two policies are going to make payments to the employee that would really offset those out-of-pocket expenses. So also good.
Absolutely. A walk-in testimony of that is actually a major chamber in America. Um, Tom Lesnick is a president and CEO of the Independence, Missouri Chamber. He's actually retired now, recently retired, and he's consulting chambers across America. There's a video online that we can share to your chamber for you to share out. Um, but Tom is a prime example of what Steve just mentioned. He said, "Hey, I met Brad through my major medical broker, which is a major name here in America. I got introduced to him. He says, I've never bought a cancer or a heart policy in my life, but because of this program, of course we got it. My paycheck went up, saved taxes. Why wouldn't I have these benefits? In May of 2023, he got diagnosed with a heart attack. His first paycheck was from his critical illness policy was $20,000. He shows that paycheck to people all the time, and he says he has a copy of it on his phone. And he said, I would have never paid this benefit had it not been for this program because I wouldn't have voluntarily purchased those benefits on my own because of that one thing we talk about, money. That's the number one reason why 70% of Americans do not purchase supplemental type benefits on their own because they don't have the extra discretionary income to do so. In his situation, he did. He just didn't spend money on things like that. So this creates that funding mechanism where an employee or an employer doesn't have to think about it. And now the employees are in a much better scenario. So great question.
Yeah, I just wanted to point out it's a really good group of new additional benefits that in this example really works well.
Yep.
And also, just another thing to point out, a lot of times these can be issued as guaranteed issues. So somebody that's already had a heart attack through the company can get these guaranteed without any health questions. So that's also a huge benefit as well.
Absolutely.
All right. Are there any other questions from anyone on the call? Okay. Well, thank you, Brad, for that great introduction to the program and diving a little deeper. So, as Brad mentioned, we handle, all the setup, the compliance. We work directly with your payroll department. No disruption to current benefits or brokers. So, if this is something you would like, we can run a proposal for your company directly based on how many employees you have. So we'll just get some basic W-4 data and then I'll pull up here. Brad, do you want to go over a proposal or
Yeah,
not?
I can do that.
Okay.
No, I can do
Okay,
that.
I'll do that first and let Brad do a real live proposal. So let me see if I
Yep.
can zoom in a little bit here. There we go. Okay.
This is after the check that I just showed you all. This is what most employers will say, well, what's the next steps? And I said, well, we can get you a proposal that does not obligate you to anything to see what the savings would look like for your own company. So once Tracy would receive that census data, which is really easily a report exported out of your payroll system, it spits out a proposal like this. And if you look at this company, I actually know this company. They're in Arizona. They're one of my employers and Tracy's. This at the top, that $91,000. This is about a 170 person group, but they're putting $91,000 a year back to their bottom line in payroll tax savings. Whereas if you were a 50 person group, that would be about 30,000 in that box. So the number is it's easy to calculate. So that's what employers want to see. They want to see that payroll or that tax savings. How we're doing that, if you look at that $14,000, 14,076 on that second column from the right, that's what I mentioned when I was going over the paycheck. We're reducing taxable wage for every employee by $14,076. For this company, we reduced their total payroll taxable wage by $2.1 million, which equates to a $91,000 net savings after everything for them yearly, not at once, every single year. What it does though is it shows us where that EE allotment is, that about the fourth or fifth column over from the right, the EE allotment. That's the numbers on that paycheck that were really that 200 number. So every employee has a different number there because it's based on their taxable situation and their gross wage and their wages. So our system shows us what savings we have from a standardized withholding report. And we know in this group that we're providing $23,000, that top left-hand box. We're providing $23,000 per month worth of additional benefits for this employer. That equates to well over, probably just shy of $300,000 worth of benefits we provided in that group for the employer, that the employer didn't have to fund and the employees didn't have to fund, but everybody's in a way better protected scenario now. But the greatest thing that this particular employer loved was they're keeping $91,000 every year that they used to be paying out to the IRS in their 941 taxes. So it's easy to get one of these reports for you as an employer that does not obligate you to anything. Thanks for bringing that up, Tracy.
Yeah.
Hey, Brad.
Yes, ma'am.
It sounds like you guys, as I said, I know work with the payroll companies and so forth, but this is assuming, all of these employees are static, don't change their HSA, their 401k deductions throughout the year. What happens when that takes place? What's the communication to the employees and then therefore their deductions on those voluntary benefits?
So the voluntary benefits are funded out of the tax savings. If somebody changes their 401k or HSA, something like that, other pre-tax deductions, that's no different than them changing it without this program. That means their paycheck is going to change a little bit, but those are voluntary items. Is that what you're asking?
Right. But does that necessitate a rework in payroll, or
No,
once it's built with
nope.
the payroll, it should be seamless?
No, we just ask for that information that you just talked about. We ask that you mentioned. That's part of our census that we get ahead of time, but we don't rework it when they make any adjustments to that, because that would be like if they made an adjustment without our program, there would obviously that same adjustment would reflect on their paycheck. But we don't rework our program whatsoever.
Okay. But again, I just wanted to make sure that it would be a flow through in payroll. So
Yep.
it sounds
Yeah,
like, yeah.
and we auto update that. We do what's called an API import. And this may sound strange, but I'm a hillbilly, Kate. The our tech team that knows all these fancy symbols, they call it API import, where they automatically upload our entries into the payroll system before anybody ever goes live.
Great, thank you.
Yeah.
And then I guess, Brad, to go along with that, if someone hires someone new, you just send this data in and it's implemented with
Yes.
them.
Yeah, to answer that, yeah, a lot of times we're working with brokers or companies that have Navigator, these enrollment platforms. But I work with a lot that we don't work with their brokers, so we don't have access to that. But we have like right now, a bunch of my big nursing home groups. Once a quarter, they're sending us all their new hires. But we have a extraction code based on their payroll software where they'll send us the list of the employees. We just extract the information, get them uploaded into payroll.
All right. Well, thank you so much for that, Brad. Any other questions? All right. With that, I'll just go down to little QR code you can scan if it's something that you want to get a proposal specifically for your company. You can scan this code and set up a meeting directly, walk you through how you can upload your census and get a direct quote. So if there's nothing else, I appreciate everyone being on here. And thank you so much, Brad. That was always so informative.
Well, I would like to add one quick thing, and that is that Tracy has updated her page on the website, and there's a link there also to make an appointment with her. So if at any time you lose track of any of this information and you're not sure where the email is, you can go to Elite, to Elite's page on our website, and you can get right back on track to get what you need.
Sounds good. Yes. Thank you, Connie. Appreciate that.
I just know everybody gets a lot of emails, and sometimes I can't find what I want.
Boy, that is true. All right.
And then Connie, we will be sending out the recording, right, to members?
Absolutely.
Yeah, because this is
And
great.
that'll be great for this week, but in 3 months, if somebody wants it, they might be like, where is
absolutely.
everything?
Wonderful.
Yes. Do you want to share your slides with the group too, or just the recording?
Yes, we could share the slides. We could put that on there as well. Yep. Sounds good.
Well, I want to thank everybody for coming, and we will do our due diligence after this and get it in the right people's hands. And thank you very much, Brad and Tracy, for bringing this to our attention. I'm excited about it. And hi, Alberto. We're just ending now. I know you were on another call. I'm sorry. I'll send you the recording though. So thank you, everybody. Have a
I
wonderful
have a
day.
quick question after we stop the recording, if it's okay.